Hi, Goldie here. Today I want to talk about the McKinsey Report that just came out. It's where they show how healthcare reform is actually going to affect employees and employers. And what they found is that millions and millions and millions of folks are going to lose their coverage, which is why so many people right now are crazed over this report. So if you remember back when reform was getting passed, the Congressional Budget Office estimated that about 7% or 10 million employees will lose their insurance. What McKinsey found, after surveying well over 1,300 different companies, is that the CBO, the Congressional Budget Office, was actually wrong in their estimation. That it's more like 30% of employers across the country are going to drop their coverage altogether. And the reason simply has to do with cost. So the new law requires companies that employ 50 or more employees to offer health insurance. And if they fail to do so, then they have to pay a fine of $2,000 per full-time employee. Now the issue here, the irony, is that in many cases it actually costs companies well over $2,000 a year to cover their employees with health insurance. So some of these groups look at it as a great opportunity to do away with their health insurance offering and as a way to reduce costs, paying $2,000 as opposed to a lot more than $2,000 per employee. Now, something interesting that came out in the survey is that when polled, an overwhelming number of employees actually said, hey, they'd be more interested in receiving a higher salary, if that's available, foregoing their company's health plans, and instead receiving their coverage through their state's health exchange. The question I have is, what does that coverage look like down the road, and what are the true costs to all involved? We're not really that sure yet. What we do know, though, is employer-sponsored health insurance is going to change. Who it affects and who it changes with is still a question mark. And when you read the study and you read other literature out there, I agree with McKinsey in two scenarios regarding companies. Scenario one, employers are going to begin transitioning full-time employees, some at least, into part-time status, which is very unfortunate. But they're going to do that to get around some of the provisions in the healthcare law to save money, number one. Number two, they're going to restructure their companies into two different entities. One entity will consist of managers, executives, high-paid folks that are going to continue to receive company's insurance. And that other entity is going to be with the lower-level paid employees who are not going to have company-sponsored insurance and instead are going to be relegated to their state exchanges. Now, regardless of what happens, however it gets played out, the thing that remains true is we need to lower costs while improving the care that folks need and deserve. And how do you do that? We need a value-based system. When you look at other sectors within the economy, high-tech sector, telecom, whatever, they've done a great job at reducing costs while improving quality and thereby really improving the goods and services that people get. We need to replicate those same efforts in the healthcare industry so that all parties involved, especially patients, are better off.